student physical therapist at the University of Central Florida. Today I'm going to be performing 2 range of motions, 2 manual muscle tests, and a muscle length test. The first one I'm going to be doing is the range of motion of hip abduction. What I'm going to do is go ahead and set up your patient supine and with one leg, the contralateral leg off the table and supported by some kind of stool. Then what you're going to want to do is have this test be, for hip abduction, is usually done actively instead of passively. So you're going to have the patient go ahead and abduct while you stabilize the hip and look for any compensations. Is this as far as you make it? Alright, you go ahead and hold here, and now you're going to go ahead and measure. So you're going to go ahead and have your stationary arm be on your contralateral ASIS. Your axis is going to be on your same ASIS, and then your movement arm is going to be on your base of your patella. So go ahead and line that up and measure. And so I'm getting 42 degrees of hip abduction, and this is 3 degrees lower than normal, which is 45. Doing extension range of motion passively, and you're going to want to set up your patient prone as close to the side of the table as possible. So what you're going to want to do is go ahead and stabilize the pelvis by holding onto the iliac crest, and your other hand is going to be on the distal end of the femur and tibia to pull it up. So you're going to stabilize and lift up until you get to the end range. So here I can start to feel compensation, and he's also getting tight. So I'm going to hold the leg here, and I'm going to go ahead and line up my goniometer. My stationary arm is going to be parallel with his trunk. My axis is going to be on his greater trochanter, and then his movement will be at the lateral condyle of the femur. And so I'm going to go ahead and line all of these points. There goes the stationary moving arm. And so I'm getting about 15 degrees of range of motion for hip extension. So he is within normal, which is 10 to 30 degrees of extension. Gluteus maximus. So you're going to want to position your patient prone with a pillow for comfort, and you're going to want to take to put the gluteus maximus as the only one working as the hip extension. You're going to flex the knee to 90 degrees to remove the hamstrings. So from there, you're going to want to go ahead and put the patient in position by pulling him into extension, and then you're going to want to stabilize with the hip. From here, you're going to have the patient hold. You can hold this, and then apply force at the distal end of the femur. So go ahead and hold for me. 2. Okay, relax. Cam was able to resist against strong pressure, so he gets a 5 out of 5 in this manual muscle test. Fascia latae. So what it's going to be doing is going to do into flexion, abduction, and internal rotation. So first thing you want to do is move your patient to the edge of the table that you're going to be working on, and he's going to be supine. And so then you're going to go ahead and put the patient in position and stabilize at the iliac crest. So it flexes, abducts, and internally rotates. So Cam, I'm going to have you go ahead and hold this position. Okay. Perfect. I'm going to relax. I'm going to apply pressure into abduction and extension. Cam, hold this position and don't let me move you. Okay. I applied force to the distal end of the tibia, and he was able to withstand a large amount of force, and he did not break. So I give him a 5 out of 5 in this manual muscle test. This is muscle length test, and this is going to differentiate between the iliopsoas or the rectus femoris in limiting hip extension. So what we're going to want to do is position your patient prone on the table, and you're going to want to take a bolster and put it under the leg that you're testing just above the patella. From here, you're going to want to flex the knee until you get to the infeel. And so I feel the infeel about here. And then you're going to want to go ahead and measure the knee flexion range of motion. So you're going to want to measure the joint line of the knee. Will be your axis. Your stationary arm will be the greater trochanter, and your movement arm is going to be the lateral malleolus. So I measure this, and I'm getting 110 degrees, which is showing that he is lacking range of motion in his knee now because of his rectus femoris